the hidden threat. Many people don't even know they have diabetes. This fact may sound surprising, but it's true. Diabetes is often called a silent epidemic because it can live in the body for years without showing clear symptoms. By the time it's detected, serious damage may already be done. According to the International Diabetes Federation, nearly 1 in 2 adults with diabetes worldwide are undiagnosed. That means millions of people are walking around unaware of a condition that silently harms their heart, eyes, kidneys, and nerves every single day. This script will guide you through everything you need to know: what diabetes is, why it hides, how it damages the body, and, most importantly, what you can do about it. 2. What is diabetes? At its core, diabetes is a disorder of blood sugar regulation. Normally, your body converts food into glucose, a form of sugar that fuels your cells. To use glucose properly, your body needs insulin, a hormone produced by the pancreas. Insulin acts like a key, unlocking cells so glucose can enter and be used for energy. In diabetes, this process breaks down. Either the body doesn't make enough insulin, or the cells become resistant to it. As a result, glucose builds up in the bloodstream instead of entering the cells. High blood sugar over time leads to a chain reaction of complications throughout the body. 3. Types of diabetes. There isn't just one kind of diabetes. There are several, and each behaves differently. Type 1 diabetes. This is an autoimmune disease where the body's immune system mistakenly attacks insulin-producing cells in the pancreas. People with type 1 diabetes need insulin injections for life. It usually develops in children or young adults, but it can appear at any age. Type 2 diabetes. By far the most common type, accounting for about 90 to 95% of cases. Here the body still makes insulin, but the cells don't respond well. This is called insulin resistance. Over time, the pancreas struggles to keep up and blood sugar rises. Type 2 diabetes is closely linked to obesity, inactivity, and genetics, but it can often be managed with lifestyle changes and medication. Gestational diabetes. This occurs during pregnancy when hormones make the body less responsive to insulin. It usually disappears after birth, but women who have it are at higher risk of developing type 2 diabetes later in life. Prediabetes. Not a full-blown type, but an important warning stage. Blood sugar is higher than normal, but not high enough for diabetes. About 70% of people with prediabetes will eventually develop type 2 diabetes if no changes are made. 4. The silent nature of diabetes. Why do so many people not know they have diabetes? The reason is that early diabetes often has no obvious symptoms. Blood sugar rises gradually, and the body adapts to this new normal without dramatic warning signs. Many people feel fine for years while high glucose quietly damages their blood vessels and nerves. That's why regular screening is so important, especially for people with risk factors like obesity, family history, high blood pressure, or a sedentary lifestyle. 5. Early signs and symptoms. While diabetes can remain hidden, there are subtle clues that should never be ignored. Excessive thirst and frequent urination. Increased hunger despite eating. Unexplained weight loss. Fatigue and weakness. Blurred vision, slow healing cuts, and frequent infections. Tingling or numbness in hands and feet. Unfortunately, many people dismiss these as normal aging or stress. By the time they seek help, the disease has already advanced. 6. Causes and risk factors. Diabetes is influenced by multiple factors. Genetics. A family history of diabetes increases your risk. Obesity, excess fat, especially around the abdomen, drives insulin resistance. Diet, high sugar, processed foods, and low fiber intake worsen the problem. Lack of exercise. Physical inactivity contributes heavily. Age. Risk increases after 45, though type 2 is now common in children. Ethnicity. Some populations, like South Asians, Hispanics, and African Americans, face higher risks. Other conditions, high blood pressure, high cholesterol, and polycystic ovary syndrome, PCOS, are linked. 7. Complications if undetected. When left untreated, diabetes wreaks havoc on nearly every organ system. Heart and blood vessels. Diabetes doubles the risk of heart attack and stroke. Kidneys, high sugar damages tiny filters, leading to kidney disease. Eyes, diabetic retinopathy is a leading cause of blindness. Nerves. Neuropathy causes pain, numbness, and even amputations. Feet. Poor circulation and nerve damage means small wounds can turn into serious infections. Skin. Frequent infections, dryness, and ulcers. The scary part? Much of this damage begins before someone even knows they have diabetes. 8. Global impact and statistics. More than 500 million adults worldwide live with diabetes today. By 2045, that number is projected to reach 7. In the first part, we explored the fundamentals of diabetes. What it is, the types, the silent nature of the disease, its symptoms, risk factors, complications, and how it can be treated or prevented. But understanding diabetes requires more than just knowing the basics. This second part takes us deeper. We will confront the myths that surround diabetes, examine the role of nutrition and exercise in more detail, consider the emotional and psychological impact of living with the disease, and look ahead to future innovations in treatment. By the end, you will have a fuller picture of how diabetes affects the human body, the human mind, and the human future. 2. A historical perspective. The story of diabetes stretches back thousands of years. Ancient Egyptian medical texts from around 1500 BCE describe symptoms of frequent urination and weight loss, conditions now recognized as diabetes. In ancient India, physicians noticed that ants were attracted to the urine of patients, a sign of high sugar levels. In the 19th century, scientists began to understand the role of the pancreas. In 1921, Frederick Banting and Charles Best discovered insulin, forever changing the outlook for people with diabetes. Before insulin, type 1 diabetes was nearly always fatal within months or years. After insulin, survival became possible. Today, technology continues to push forward. From insulin pumps to continuous glucose monitoring, the fight against diabetes is constantly evolving. 3. Myths that mislead. Even with centuries of study, myths about diabetes still spread confusion. Sugar directly causes diabetes. While excess sugar can contribute to obesity, which is a major risk factor, diabetes is not caused by sugar alone. Genetics, lifestyle, and environmental factors all play critical roles. Diabetes only affects overweight people. Many people of normal weight develop diabetes, especially type 1, which has no connection to body size. If you feel fine, you don't have diabetes. As explained earlier, diabetes can remain silent for years. Feeling healthy doesn't mean you are risk-free. Diabetes is a mild condition. There is nothing mild about a disease that increases the risk of blindness, kidney failure, heart attack, stroke, and amputation. Medicine alone is enough. Treatment is a combination of medicine, diet, exercise, and regular monitoring. Believing these myths delays diagnosis and treatment, allowing the disease to do more damage. 4. Nutrition in depth. The power of food. Food is at the center of diabetes management. Choosing wisely can reduce spikes in blood sugar and protect long-term health. The glycemic index, GI. The glycemic index measures how quickly foods raise blood sugar. High GI foods, white bread, candy, soda, cause rapid spikes. Low GI foods, beans, lentils, whole grains, leafy greens, raise blood sugar more slowly and steadily. The glycemic load, GL goes further by measuring not just how fast, but how much sugar a portion of food will deliver. This makes it an even more practical tool for meal planning. Recommended foods: whole grains, oats, barley, quinoa, vegetables, leafy greens, broccoli, peppers, lean proteins, fish, chicken, tofu, healthy fats, avocado, olive oil, nuts, low sugar fruits, berries, apples, pears. Foods to limit: sugary drinks, sodas, sweet teas, energy drinks, white rice, white bread, and refined flour products. Fried fast foods high in trans fats. Pastries, candy, and desserts loaded with sugar. Balanced meals that include fiber, protein, and healthy fats slow down digestion and reduce blood sugar spikes. 5. Exercise as natural medicine. Physical activity is one of the most effective non-medical treatments for diabetes. Regular exercise improves the body's sensitivity to insulin, lowers blood sugar, and protects the heart. Aerobic exercise, walking, running, cycling, or swimming for at least 150 minutes per week is recommended. Strength training, lifting weights or using resistance bands builds muscle, which uses glucose more efficiently. Flexibility and balance. Yoga, Pilates, or Tai Chi reduce stress and improve overall health. Even daily habits matter. Taking the stairs instead of the elevator, walking after meals, or stretching during work breaks all contribute to better blood sugar control. 6. Mental and emotional health. Diabetes is more than numbers and test results. It is also about the mind. Managing diabetes requires constant vigilance, checking blood sugar, monitoring diet, taking medications, and scheduling medical appointments. This can create diabetes burnout, where patients feel overwhelmed. Studies show people with diabetes are more likely to experience depression and anxiety. This creates a dangerous cycle. Stress hormones like cortisol raise blood sugar, making management harder, which increases stress even more. Coping strategies. Support systems. Family, friends, and community groups provide encouragement.